Z-Dog MD, back in effect. Thought I'd go through a few of the New York Times health section articles that I thought were interesting this week. The first one is about the lost art of the physical exam and how doctors shortchange it in favor of tests and things like that. You know, the truth is the physical exam, in my opinion, it's kind of like a relic of a bygone era, you know, like the old Republic, like the Jedi or something. It doesn't really do a whole lot, but it's got a lot of mumbo jumbo around it. You know, this whole healing thing and the laying of hands. And actually, I mean, in all honesty, it does seem to work in real life. You know, every doctor who ever talks about this in articles, it always comes off as some kind of Yoda-esque kind of figure. They're always like, CT scanners, MRIs, an MD needs not these things. An MD's strength flows from the clinical exam. It's like they hover over the patient or something. They're like, I sense much stool in you. You know, even I've gotten in on the whole Yoda game in the hospital. The interns are always trying to get patients out as quickly as possible, discharge them fast so that their workload will be decreased. But you know, I'm just like, you are reckless! Failed to complete the treatment your patient has. Not ready to face the nursing home is he. If rushed to discharge now you do, bounce back, your patient shall. I did get in a little trouble with the dean though for forcing the interns to carry me on their backs. Apparently not cool these days. The next story I wanted to talk about is about how foreign-born medical graduates who train abroad actually have been found to do just fine here in the United States, providing equal care to locally trained physicians. Now, I could have told you this because both my parents were trained in India. They're both physicians, and they both think they're the biggest badasses in the world. My dad in particular is something else. He's always lecturing me about the superiority of how he trained. And, you know, he may have a point here. He told me about a patient who came in with some right-sided abdominal pain, and it really, to me, sounded like an infected gallbladder or a stone or something like that. And I said, did you get an ultrasound? He said, what? Ultrasound? Why do I want that? I have perfectly good 2 fingers. I said, what are you talking about, Dad? He said, I just percussed the hell out of it, man. What do you need ultrasound for? Check it out. 2 centimeter gallbladder stone. I believe it is lodged in the neck of the gallbladder. There's a little bit of pericholecystic fluid. Suggest clinical correlation. Unbelievable, man. You know, the guy will never do any diagnostic tests because over the years he's developed his physical exam to just such an incredible extreme. His ears have become huge and bat-like. So when a pregnant woman comes in, he doesn't need to do an ultrasound. He just points his mouth at the belly and goes, listens, and he's like, it is a boy. Approximately 26 weeks. So whereas the foreign-born and trained physicians did very well in this study, the American-born physicians who trained abroad did not fare as well. They had worse outcomes, longer hospital stays, etc. Most of the Americans who train abroad train in the Caribbean. So the question was, what's the deal here? Are the Caribbean schools not that good? I think it's more that they have a different philosophy and a different approach. I'm a little surprised sometimes when interns come in and they're from the Caribbean. When they present a patient, you know, it's something like this.
Arr, patient is a 37-year-old landlubber, status post keel hauling. Examination of his extremities reveals a peg leg with termite damage proximally. Impression? Scurvy. Plan? Walk the plank.
Walk the plank.
Aye, shiver me timber, where's me bird? Is he up in the ventilators again? Arr.
Yeah. Z-Dog MD.